And so I would like to welcome you to this month's Beginner's Circle Spirit and Science preparation class. We're going to be talking about ketamine and ketamine-assisted therapy. And I am, again, very, very, very happy that you're here. We're going to start off, I'm going to talk a little bit about preparation and from a meditative perspective, and then I will pass it over to Dr. Eric, and he's going to talk a little bit more about ketamine from a therapeutic perspective, a little bit more scientific and grounded aspect, perhaps, and then we will answer your questions. Sound good? Everybody still in the right room? Cool. So one of my experiences with ketamine is that I find for me that it blows me off center in a lot of ways. In some ways it helps me to find my center, but in some ways it sort of takes the focus and attention, the concentration of my mind, and it just does whatever it wants with it. And there is this experience that I have a lot of the time of remembering who I am and remembering my intention, remembering why I showed up to this medicine in the first place. And so there is this sort of being blown apart and then finding cohesion again, being blown apart and finding cohesion again. That is a really interesting experience for me. And it's not unlike my meditation practice in a lot of ways. And I find that there are certain meditation practices that seem to be really good for me if I know that I'm preparing for a ketamine journey. And it's really a very simple practice. I mean, I know, if you know me, you know that I'm very comfortable with sort of arcane meditation practices that have a lot of steps and require a lot of visualizations or mantras or what have you. But when it comes to this, one of the practices that I'd like to share with you is just a very basic concentration practice. And it's the practice that when I tell people about it, they say to me, "Oh, I can't do that. I can't get my mind to be quiet. I can't get my mind to be clear." And, my thought is, well, of course you can't. Your mind was not necessarily even designed to be clear. And to think that it's just going to be clear right off the bat is, well, it's innocent. It's innocent and it's quaint, but it's not reasonable. And so, oh, hold on, I'm getting a little bit more music coming from somewhere. More Kundalini music. Okay, there we go. Excuse me. And so what I often tell people is that what we're not trying to make the mind clear necessarily. What we're doing is we're training ourselves to come back to center. Right? You see the difference? Right? It's like, we're not just sitting there expecting a particular state of grace to fall upon us. What we are doing is we're training ourselves to have a stronger mind, right? To have a clearer ability to attend and to focus, right? It reminds me of something that I think there was a time when I was like listening to Tony Robbins tapes or something, 15 years ago or something. Somebody gave me some Tony Robbins tapes, and they weren't half bad, to be honest. And one of the things that he said in the tapes was, "Don't wish it was easier, wish you were better." Right? And he wasn't saying it from like a critical kind of place. It wasn't like, "Oh, you're bad, like you're not good enough." It was an understanding that we actually had an opportunity and a responsibility to grow as people. And that's what we're doing. That's what we're doing here. That's why we're showing up to do, therapeutic, ceremonial, transformational psychedelics, is because we know that we can, in fact, be the people we're meant to be. And that the challenges that come our way, the fact that our mind won't be clear, or the fact that we're having a hard time with our careers or our relationships, the idea is not to just wish it wasn't there. The idea is to, like, how do I grow as a person so that I can meet these challenges in the ways that I know is possible for me, right? And so this very simple meditation practice is all of that, is that commitment and intention set up as a two-step meditation practice, a very, very simple meditation practice of following the breath, right? So taking your attention to the breath, noticing when the mind wanders to something else, and then bringing it back, right? So I guess it's 3 steps, right? And then repeat. And so the idea is to not force it to not wander. It's going to wander. It's good. It's just like to just do the repetition, to put in the work of bringing it back, bringing it back, and bringing it back. And I didn't know this the first time I did high dose ketamine, but this practice has been crucial for me personally. And so if you don't mind, let's do it for like 5 minutes. Let's just do it for 5 minutes. Maybe you're doing it already, which is great. You're ahead of the curve. But so until about 5:20 or 8:20 or so. And so you can either close your eyes, or if you have like a mandala or something beautiful that you'd like to focus on, picture of your teacher or something like that. I don't recommend you eye gaze with me, but you could, or you can also close your eyes. And just watch the rising and the falling of the belly. Right? Just watch the breath down low. When the mind wanders, simply embrace it as an opportunity to strengthen your resolve and your focus, your attention. Maybe just a few more breaths, really savoring these last breaths. Yourself to orient back to the room. If you have some water around, take a sip of water. If you have any questions, perhaps jot them down, because we will take the questions after Eric presents. And, thank you for practicing with me. I will replace Eric's pin. Thank you so much for being here. And take it away.
Good evening, everyone. Thanks for coming to this gathering tonight on ketamine. Ketamine is the main event. I'm Eric Sienknecht. I'm a psychologist. I have a private practice in San Francisco, and I'm one of the co-founders of Polaris Insight Center, a ketamine-assisted psychotherapy clinic and training center. So we provide ketamine-assisted psychotherapy to treat depression, anxiety, trauma, and other indications. We also do training. We provide training for clinicians who are interested in learning how to offer this medicine in combination with psychotherapy in an ethical and compassionate way. I have a long-standing interest in psychedelics and non-ordinary states of consciousness. I'm also a huge music lover. I spend a lot of time listening to music, and for a living, I get to make playlists to take people on psychedelic journeys. So I feel very fortunate. So I'll go ahead and, so I'd like from the majority of this to be discussion, question, answer. And so kind of to get through my kind of didactic part so that we can have discussion. But I think it's good to just provide you with some broad brushstrokes of ketamine. I'll kind of talk about the signature of the medicine a little bit about the history, and then I'll kind of go into how we use it therapeutically, and talk a little bit about preparation, integration, setting, and show you some pictures of our clinic, and then we'll open it up for questions. And as I go, if you have questions, like Daniel said, just jot them down, and then we can have a discussion afterward. So can you all see that? The slide?
No.
No. Okay. Let's see. Oh,
I
have to share my screen. Okay. What about now?
Great.
Okay, cool. So ketamine is a very fascinating molecule. It is actually not a traditional psychedelic. It's a dissociative anesthetic. It has an anesthetizing effect on the body. So as one begins to feel the effects of the medicine, they'll notice some numbness in their body, and at higher levels, higher doses, they may lose a sense of having a body altogether and travel beyond the body into a variety of non-ordinary states of consciousness. I like to think about one of my nicknames for ketamine is a Swiss Army knife of psychedelics, because of the variety of experiences that people report under the influence. I'll go more into detail about the kinds of experiences that people have, but it's a powerful psychoactive substance. I believe that when you're offering ketamine in a psychotherapeutic setting, you should be trained to do so, which involves really kind of understanding kind of best practices about how we can use this medicine to optimize therapeutic potential. I also believe that the therapists who are offering the medicine should also have an experience with the medicine they're offering to kind of know the territory and be able to know the territory, more importantly, to know themselves. Psychedelics are mind manifesting, and soul manifesting. So it's such a powerful tool for people to understand themselves better, including therapists. And there's a debate about that in the field, about whether that the psychotherapist doing the psychedelic therapy should have their own experiences. But I think most people would agree, even intuitively, that that this is an important component of being a competent psychedelic therapist, and open for discussion around that as well. So just a little bit about the history of ketamine. Ketamine is a relatively new substance. It was synthesized in the mid 1960s, and they were trying to find a replacement anesthetic agent for PCP. PCP was once used in anesthesia, but because of its long-lasting effects and higher and toxicity as well, they realized it's not the ideal anesthetic agent. So they synthesized ketamine. They found that it's like much shorter acting, much less toxic, quite safe. And for the past 50 years, ketamine has been used safely and effectively as an anesthetic agent in children, adolescents, adults, and the elderly. It's on the World Health Organization's list of the top essential medicines. Ketamine is perhaps and arguably the most safe and effective anesthetic agent available. So that just gives you a little sense of the safety profile. It's very safe. Also with ketamine, with other psychedelics, people have to, with MDMA, you have to kind of come off of some other medications that you might be on, particularly the SSRIs, because there's a risk of serotonin syndrome if you combine the SSRIs and the MDMA. But that's not the case with ketamine. Ketamine actually works on a completely different neurotransmitter system, the glutamate system. And so it's not serotonergic. So it plays well with other SSRIs, and it makes it a very good candidate for treatment of depression. If someone doesn't want to come off the SSRIs but wants to try a different treatment. So when ketamine was first used in the medical establishment in the early 70s, doctors and medical professionals started noticing people coming out of the ketamine anesthesia and being disoriented, having visions, basically tripping. And they weren't prepared, didn't know how to handle supporting someone through a psychedelic experience. And a lot of, there's a lot of adverse events. I think not a lot of like danger to the self, but or others, but just a lot of chaotic things unfolded. If any of you have tripped before, the last place you want to be tripping is like a buzzing, beeping hospital room. So they started calling it the emergence phenomenon, and they saw it as a side effect of ketamine and to control for and minimize. Around the same time, there were some pioneering psychologists around the world, a few, very few, but a few that saw the emergence phenomena that was seen as a side effect to be avoided in the medical community, actually as like the magical ingredient for accessing other states of consciousness and healing. Salvador Riquet was a Mexican psychiatrist who was maybe the first clinician to work with ketamine psychotherapeutically in the middle 1970s. There were others as well, Eli Kolb and Evgeny Krupitsky, two Russian psychiatrists who worked with ketamine and actually wrote up their results in papers, published articles, did studies. But other than that, the mind-altering effects of ketamine were really not studied until, seriously until the past 5 to 10 years. So let's see. And as many of you may know, more recently in the early 2000s, people at the researchers at the National Institute of Health were studying the antidepressant effects of ketamine, and they found that it has robust antidepressant properties. They did many, many studies, and here we are now in 2021. Ketamine is actually an FDA-approved on-label treatment for depression, for major depression, treatment-resistant depression. You may have heard of Spravato, which is a nasal spray that was synthesized by Johnson & Johnson. They use that now for treating depression. So here we have a legal psychedelic that is being openly used for depression. There's the chiral molecule ketamine. A little bit about the ketamine signature. So what does it feel like to be under the influence of ketamine? It's, as I was saying, it's quite safe, rapid metabolism, rapid onset. We use two different routes of administration in our clinic, the intramuscular injection and the sublingual lozenge. One, a nurse or a medical professional needs to be present in order to administer the medicine through injection. Using lozenges, if the patient has a prescription, they can self-administer the lozenge, and medical professionals actually don't need to be on site. And the lozenges you hold in your mouth, it rapidly dissolves, and then you actually have to hold the liquid in your mouth for about 15 minutes while the medicine is absorbed through the buccal membranes. And then you can swallow or spit the medicine out. So these are two different routes of administration. One of the great things about ketamine is it's like quite flexible for the therapeutic process. You can use ketamine in lower doses, and you can also use it in higher doses. So in the lower dose, we call those psycholytic sessions. So the patient may be feeling some mild to moderate dissociation from the body, of maybe a sense of floating above the body, but they're mostly still in the body, in the room, and have access to language and are able to kind of talk pretty coherently about what's happening. And we also notice at this dose level that people feel less inhibited. They're able to free associate more easily. Oftentimes, the lower dose psychedelic sessions look like a deep psychotherapeutic, extended psychotherapeutic session with a lot of back and forth with the therapist, a lot of things coming up and being processed, not unlike an MDMA session. There's also a greater empathogenic effect at that dose. People want to connect and relate often. And then at the higher dose, we call these the psychedelic dose, psychedelic sessions. People are largely internally focused. They are, ketamine can be quite visual. Even people who have experience with other psychedelics and have never had a particularly visual experience on psilocybin or LSD, they can have a ketamine experience and have like a very deep, immersive visual experience. So there's something about ketamine and that connects us with our capacity to imagine our imaginations, and depending on your paradigm, connecting with like the third eye and certain perhaps higher level ways of seeing. If any of you have ever tried a flotation tank, this is kind of the best way to, I think this is the best way to kind of simulate the ketamine experience without actually taking ketamine. You're floating in a dark tank with on top of some very, very salty water that keeps the body completely buoyant. You can kind of let go and relax completely. And so you're not receiving any kind of light or sensation through touch, through the senses. So it's, people can have experience of like losing a sense of their body floating, and even transpersonal experiences in the float tank. So people also have an experience of what I call witness consciousness, or the observing self. So people will say like, I see my mind working, I see the thoughts going and the beliefs that I normally buy into, but they're kind of like removed. They're like out there, they're kind of floating around. And there can be a profound realization that you are not that. You're not your thoughts, you're not your beliefs, you're not your memories even. You're vaster than that. And so that can be quite powerful realization for people who are so identified with their conditioning, with their conditioned ways of thinking, to realize that they're more than that, and that they actually have a choice whether to identify with that more narrow perspective of themselves, or to identify with something greater. People have report experiences of transcendence of time and space. They lose track of time. How long was I in that session? How long was that? It was about an hour. An hour? What? That couldn't have been an hour. I mean, so much stuff happened like that, so you hear stuff like that. It's people also have often have the experience. This is like very much a part of the signature of this particular medicine, I think, is a sense of spaciousness, inner spaciousness of the inner world, and floating above, moving up, sometimes kind of floating through space, flying over landscapes. So there's ways in which the medicine is kind of teaching us about different ways to kind of experience space and time, and that comes through in the imagery that people often report. Music is an essential part of the experience. If you ask me, I'm a bit biased, but you'll find if you ask other clinicians doing this work that most often people there's a playlist that has been prepared before and is used to kind of carry the experience and take the experiencer on a journey. I could talk for, I actually have a 4-hour workshop exclusively on ketamine music, so I could talk a long time on that, but for the sake of time, I'll keep it short. People report a reduction in negative, obsessive, self-referential thinking. They report having gained a greater perspective. I have to say this, it does seem like it's a medicine of perception. Like it helps, it shows people like different ways of looking at the same scene. So you might be kind of watching a scene unfold and then suddenly you're kind of panning out, and you see it like further and further and further in the distance, and you see the sky above and the landscape and the rivers and the mountains, and you're kind of going out. And then also people have the experience of going, focusing in on something and going into the cellular dimensions of what they're perceiving. I've also had people describe a scene suddenly becoming blurred and then the scene literally kind of falling away like it was a piece of film, like a freeze frame, and then it kind of like actually falls away from the view, which is interesting to the implications of that there's an aspect of consciousness that is not unlike a camera or a camera. Like it has similar qualities, and the medicine is kind of like revealing this to us. I'm going to talk about non-ordinary states of consciousness in a minute. People report interconnectedness, humility, awe, gratitude, union with God, union with the divine consciousness. Just want to mention that, ketamine is a synthetic that's been relatively recently invented, but what we're doing in ketamine-assisted psychotherapy and other ways, other medicine work is really based in thousands, tens of thousands of years of working with this medicine in various indigenous cultures around the world. And we owe our indigenous ancestors a debt of gratitude for keeping this medicine work alive and carrying it into modern day, where we can then study what they have been doing and learn from them and adapt some of these techniques to the needs of Western culture. These are a couple of, so Maria Sabina, you all probably know, was Well, one of the first curanderos who worked specifically with psilocybin mushrooms to be known in the Western world. And she's kind of credited as the grandmother of the mushrooms that she taught visitors from the West how to use this medicine in a sacred way, in a ceremonial way. And then it's a very sad story that because of the interest and the influx of Westerners into her village, to you know, some seriously wanting to learn from her and her ways, others wanting to get high, and so when the police found out about this, they kind of noticed this huge influx of people into the village. They stepped in and threatened Maria Sabina, and the community actually exiled her from the community, and she and so it's a very sad story, but she's someone that we should all appreciate as a pioneer. The other two people I'll just mention briefly, Don Jose Campos and Tito de la Rosa, are I know that Don Jose is Peruvian. I think Tito is also Peruvian or Colombian, but they are ayahuasqueros, and so they've also been influence on our work at Polaris Insight Center. I've met Don Jose a few times, and he's an amazing guy, and he's an amazing teacher, and he's the most brilliant charango player I've ever heard. It's quite magical. Okay. And just a nod to some of our influences at Polaris. We in the bottom, Annie and Michael Mithofer, we trained with them through the MAPS training for the MDMA trials. These were really the first researchers who did work with MDMA clinically, and supported by Rick Doblin and MAPS to the right. They are wonderful people, and they're still teaching and training, and they're still doing the study. So they've been doing it for, over 20 years now. And they were heavily influenced by their training in holotropic breath work, which was a treatment modality designed by Stanislav Grof on the left and his wife, Christina Grof. And Stan, in the 70s, he worked with LSD clinically, and before it was made illegal, and wrote papers and books and published studies and organized conferences. And it was LSD was considered to be the most promising medicine in psychiatry ever, until it was made illegal in the early 70s after Timothy Leary in the 60s. And but Stan was really the father of working with psychedelics clinically, and he always has emphasized the importance of non-ordinary states of consciousness and the potential for healing through non-ordinary states. And he developed holotropic breathwork to simulate the psychedelic experience, to give people an experience of these non-ordinary states without actually taking medicine, just using evocative music and deep breathing. And so Michael and Annie were trained with Stan, and carried that work forward into the MDMA therapy study and training. And at the top is Raquel Bennett. She is a psychologist in Berkeley and a ketamine specialist. And we've worked with her, trained with her, consulted with her. She's very active in the space. She has a deep appreciation of not only the medical benefits of ketamine, but also the psychological and spiritual, transpersonal benefits. And so she has a very wide angle lens view of the potentials of ketamine, and speaks very eloquently about it, and has she heads the Kriya Institute, has put on the Kriya conference for a number of years. It's no longer running, but it was a very wonderful conference to be a part of, and brought a lot of people together who wouldn't have otherwise connected. And then in the left is Julaine Andrews and Phil Wolfson. They head the Ketamine Training Center, and continue to provide ketamine training for clinicians. And they also have a center in Marin. But Phil Wolfson is editor of the ketamine papers, as many of you may be familiar with. And it's considered kind of like, the godfather of ketamine, or the godfather of ketamine therapy right now. I've spoken a little bit about this. I won't spend too much time, but there's kind of 3 different paradigms to think about therapeutic ketamine from. The medical is, we have a lot of there's been this proliferation, I guess is the word, of ketamine infusion clinics. And these clinics are in the medical model. They are usually run by anesthesiologists or psychiatrists, and they generally will provide ketamine either through IM, intramuscular injection, or IV. And most of these clinics keep the dose quite low, around 0.5 milligrams per kilogram. At this range, people don't have out-of-body experiences or transpersonal experiences. It's more about getting the medicine in, administering the medicine specifically for antidepressant properties. Then you have the psychological paradigm, which is combining ketamine administration with psychotherapy. And this is what we do at Polaris Insight Center. We have 3-hour psychotherapy sessions. The therapist is with the patient the entire time. It's largely, I mentioned the low dose relational sessions and the high dose psychedelic sessions, but sometimes we keep the dose low in order to kind of really maximize the impact of the relational aspect of the work, maybe do some trauma-informed psychotherapy. I'll talk about the inner-directed approach that we use in all sessions in a minute. And then, but the core of the psychological treatment is like the relationship between the therapist and the patient, and that's like the container of the work. So it's important to have a good therapeutic alliance, and to have good, proper preparation for the journey and integration afterwards. The transpersonal shamanic paradigm is really kind of emphasizing the potential for healing through non-ordinary states of consciousness. And so this is, healing at a very deep and broad level, which is beyond the body and even beyond the mind, that people can have spiritual experiences, mystical experiences, connections with God, connections with other beings, download of information from the Akashic records. The list goes on. And so we think that actually all 3 paradigms are important to keep in mind, and we actually use all 3 of them in our work. at Polaris, but they are kind of distinct dimensions of healing. This is a picture of an infusion clinic. As you can see, it's quite medicalized. There's blood pressure monitors and IV equipment. And in these infusion centers, you may be separated from the next patient by a curtain. There's not a lot of privacy necessarily. And some infusion centers are better than others, but this one's a particularly stark one, I think, just to get the point across that this is the medical model approach. And then here's a contrast. On the left, we have like actually a pretty nicely designed infusion room, but you still have the medical equipment. And then on the right, this is one of our treatment rooms at Polaris, and the patient's lying down, comfortable, has an eye mask, headphones, and it's more like a living room setting. They're comfortable, and there's no medical equipment. These are some pictures of our clinic. You can see on the bottom left that there's a stack of medicine cards and some Palo Santo in a bowl, and so and some feathers. We actually use these in our sessions to create a more of a ceremonial feel to the experience, using the Palo Santo or sage to kind of clear the energy. We use the medicine cards optionally. Not everyone likes it, but most people do. The patient will express their intention, and then they'll draw a medicine card, and the medicine card has some kind of archetypal image on it and a meaning behind it, and so that can add like another layer of meaning to the experience. Let's see. So I'll just show you some of our treatment rooms. As you can see, they're quite comfortable. They're quite bright in these pictures, but the most conducive environment for taking ketamine is really actually a darkened environment. So the curtains would be drawn, the lights would be dimmed. So it has more of like a cave-like or womb-like environment. Bright light can actually be glaring and uncomfortable when under the influence of the ketamine. That's another reason for the eye masks, is to kind of like limit the amount of light coming in, and to focus your attention on more on your inner experience and to minimize distractions. I'm not going to spend too much time on this actually, but this is just an overview of our ketamine-assisted psychotherapy protocol. So these are just the general kind of stages of treatment. There's the screening, the initial screening to make sure someone is a good candidate for the treatment. Sometimes they're not a good candidate, so we might recommend other kinds of treatments and refer out. There's the intake session, which the patient does with the psychiatrist, the medical provider, as well as the therapist who they're going to be working with. So it's a two-part intake. We also do some baseline testing to get their baseline functioning. And then we kind of administer testing at periods throughout the treatment to measure their progress. Then generally we'll have a preparation session where we kind of talk about the importance of set and setting, the proper kind of orientation to the experience. We talk about beginner's mind, letting go of expectations, and really entering into this more meditative state of mind where you're open and curious about what's unfolding in the present moment, and you're not trying to get anywhere or do anything. It's just about really being fully present and learning from experience. So beginner's mind is a pretty helpful concept for people. Then there's the CAP session, which is scheduled 1 or 2 or 3 days after the prep session. And it's a 3-hour session. Maybe I'll say more about that later, but and then usually we'll have an integration session afterwards. Not always, but most of the time we will have a separate integration session after they've come down from the ketamine and they've had a little bit of time to think about, reflect, integrate, and coming back together with the therapist and talking about the experience, processing what came up, remembering, and thinking about how to kind of bring the insights that they had in the journey and apply them to their daily life and start to kind of live the insights. And the average number of ketamine sessions is usually somewhere between 6 and 10 sessions, so over the course of about 2 to 4 months. So people are maybe having a ketamine session once or twice a week, more frequently in the beginning, less frequently over time. I'm not going to really speak to this slide tonight. I've spoken a little bit about this, the therapeutic model, that the relationship is the primary support for the experience, the importance of music, set and setting, preparation, integration, 3-hour sessions, and the emphasis on, or at least the openness to an understanding of the non-ordinary states as a doorway to healing. Daniel, I don't know how we are with time. I meant to spend about, so it looks like we have about an hour. I don't want to spend too much time talking here.
Yeah, it's, our numbers are holding steady. We've got about 43 people who are hanging on your every word. And, you wrap up as it feels natural to you, and then we'll just take questions until it sort of peters out. Either they'll get tired or we'll get tired.
Great. Sounds good. I'll say that, as Daniel was saying in the beginning, and I really, so much work can be done in the preparation phase of the treatment to really set the stage for the rest of the treatment. So preparation is so essential. We have an informed consents where we kind of lay out exactly what we do, our approach, benefits and risks of ketamine. People are very informed about what they're getting into before they begin the sessions. Importance of, we also use therapeutic touch if indicated, and if the patient wants it, most importantly. But we'll have a discussion about the use of therapeutic touch. Usually that's something like, a hand hold, or maybe a hand on the shoulder. If they feel comfortable, maybe a hand on the heart. So it's kind of very simple touch. We always make it clear there's no sexual touch of any kind that will happen during the treatment. Also, we always want to get consent before touching. So we will say, we'll address it in the prep session that this is an option. If you think it would be helpful, I might offer it at some point during the session. And if it feels right, then can say that you like that, and then but also you can always say no, that doesn't feel right. And so I guess I also want to say that, like, consent for touch is not just one single conversation in the beginning, but it's important to kind of like address that multiple times throughout the treatment to make sure that, you know, the patient is very clearly like wanting the touch. And there's more to say about that, but it's it's important to be really sensitive about that as a clinician. But touch can be very healing. I've had sessions where people have really needed to have a hand hold, and that really catalyzed a deep process that helped them to heal some deep attachment wound that they had. To have an emotionally corrective experience of touch and support, physical support. So it's also a very important aspect. I'll just say briefly that we talk about this concept of the inner healing intelligence, and it's the inner healing intelligence is a capacity that we all have to move towards wholeness. Similar to getting a cut on the arm, the body kind of naturally and largely unconsciously heals over time. We also have that capacity in our psyche, that there's a natural kind of inclination and movement towards wholeness. And sometimes it's a matter of just like getting out of our own way, calming the monkey mind, calming the calculative, analytical part of us, and entering into a more meditative space where this inner healing capacity can really arise and take us where we need to go and show us what we need to learn. And so we talk about the importance of this, and some people buy in right away and they know that part of themselves. Other people are skeptical, and so we try to meet people where they are, and maybe there's a different way of thinking about that that's more palatable, like instinctual. I mean, there's different kind of terms we might use for that, but it's over many ketamine sessions, I've seen it time and time again, that there's this mysterious way in which people have the experiences that they need in order to move towards greater wholeness and health. And there's no way that the therapist can kind of anticipate or predict that. And so the therapist has to practice trusting that, and getting out of their own way, and getting away from their own biases and belief systems, and kind of letting the inner healing intelligence guide this session. And then I'll just say one other thing about our approach, the inner directed approach. We want to create conditions in which the patient is not distracted by the normal outside things that are going on, that they can like learn and practice how to connect in with their inner healing intelligence, with their intuition, with their inner oracle, and really consult with that part of themselves and learn, and then come back and share. So we use eye masks and music to help kind of invite people into a more meditative state. If someone's talking a lot and still kind of in their identified with their calculative analytical mind, we might invite them to see what it's like to kind of go within and spend some time in silence and see what comes up and be curious about that. And so that's kind of the essence of the inner-directed approach, is we're not like saying, you know, you got to be like still and quiet the whole time. But it's more like use the resource of your inner world, and there's a lot of information there, and you can learn from that. And it's not all about talking and processing. Okay. I've talked about the low dose and the high dose already. I've also talked about the empathogenic experience that people have with ketamine: greater relaxation, greater comfort, warmth, compassion, empathy, love, peace, openness. We hear that a lot from patients. I probably won't address this tonight, but there have been researchers and clinicians that have tried to categorize the different altered states of consciousness and kind of put it into create a cartography of the mind. And so these are some examples. Groff on the left: the biographical, perinatal, collective, archetypal, mystical. Chris Beisch, who worked with high-dose LSD sessions, self-experimented with high-dose LSD sessions and wrote about them. He has a great book called, I think it's LSD, The Mind of the Universe, or something like that. But it recently published a couple of years ago, and it's a pretty fascinating story of his journey with taking high-dose LSD sessions, 500 mics and up, like very high dose. And he would do that about 2 times a year for about 20 years. And he would write about them and come to, and so he developed these levels of consciousness through that work, and wrote about them. And then Eli Kolp is a ketamine assistant, maybe the first ketamine assisted psychotherapist. He was using ketamine with his patients in the 90s, and he would write down features of their experience and developed a cartography. There's several psychotherapeutic approaches that actually work well with ketamine. But most of these approaches are more useful in the integration phase of treatment rather than in the medicine sessions. I'm not going to talk about transference, countertransference tonight. Sorry, I just, well, actually, I will say one thing. In the psychedelic states and non-ordinary states of consciousness, people are more porous and suggestible. This has been shown time and time again. Maybe some of you have had experiences of that yourself, of really being so open and really, really vulnerable to suggestion. And that can actually work well therapeutically. You can use the patient's own positive self-beliefs and reflect those, and they kind of land in a different way under the influence. But it can also be used nefariously as well. We have the MK Ultra experiments by the CIA, where they actually used LSD to study mind control, and there were a lot of egregious harmful things that happened during that program and came out of that. So something to just keep in mind. I think for sake of time, I think I have 1 or 2 more slides here. The integration process is just very important piece of the treatment. integrare is integration comes from the Latin integrare and means to make whole, to renew, to repair, to begin again. We're in the integration process, we're making meaning from the experience, putting words to it. We're processing challenging experiences, intense emotional experiences that come up in the medicine sessions. We're applying the insights that we learned and sorting out how to kind of live the insights, maybe making some behavioral changes and ways of changing ways of thinking, figuring out ways to remember the insights. Sometimes it means shifting and changing or adapting one's worldview and one's belief and value systems. Some people get into meditation after a series of ketamine sessions, which is really interesting. And people who have had a meditation practice before and come to ketamine, they recognize it's like a similar thing as Daniel was talking about in the beginning. So real change happens. People can change dramatically over a short amount of time. There's certain challenges to integration that I won't go into, but the integration process and the healing process is a zigzagging process. It's not linear. So there's sometimes a sense of like 2 steps forward, 1 step back, 3 steps forward, 5 steps back, 7 steps forward. So it's like I'm getting better, but then like the stuff that the depression has been kind of keeping at bay is like coming up now. Now that the depression has lifted, now I'm in touch with like the underlying anxiety, insecurities, the things that I've been kind of numbing out to through the depression. And so it can sometimes look like greater anxiety for a period of time following a session. And that's actually a good thing, that they're more activated and they have more access to the underlying emotional process that they haven't had access to with the depression. And so again, the integration process and working with someone in an ongoing way, not just in the medicine sessions, but in ongoing psychotherapy is important to kind of keep that in perspective and to support people. Okay, sorry for talking so much, but that's the end of the presentation. And so we will just open it up for questions, conversation.
Thank you so much.
You're welcome.
Yeah, appreciate that. You don't apologize for coming and doing the thing we asked you to come and do. But yeah, I would just like to, thank everybody for your kind attention, for hanging out with us. And, for those of you who are watching on YouTube, thanks for watching. It's the end of the video for you guys, but please come to the next one live and you'll be able to participate in the question and answers. These happen on the second Thursday of the month. And, if you go to tamintegration.com, you'll see the schedule. And so I'll see you next time.